Hello, welcome to the iCON Virtual Health Forum. How are you? My name is Barbara Ho. I'm a registered nurse. I'm a Chief Nursing Officer of iCON Chinese Division. I'm the MC of today's event. Welcome people join us online. Welcome to this health online forum. Healthy living, healthy heart. Digital emergency medicines, which have established over 16 years, led by Dr. Ho. The purpose is to help BC multicultural groups, patients, their families, by reliable health information, community resources, and network in respect of chronic disease education, prevention, and self-management by way of forums, health forums, workshops, and web technology to help patients with sick disease awareness, teach them best health practices to reduce disease risk, and advocate for formal therapies, and also help them access reliable health network and electronic tools, become more familiar with technology, digital technology, and how to use them for better health quality. How are you, everyone? Thank you. Barbara, I'm so happy to have the opportunity to meet an old friend of iCON and also a new friend to share the iCON Healthy Living, Healthy Heart. I'm Dr. Ho. I'm an emergency physician and also the executive director of iCON. I'm so happy to talk about e-health. In BC today, we have get all the in the slide that we get everything there shown in the chart, and we are making progress. I hope in this 15 minutes to give you an overview and to share this. Thank you. My staff are very quick to put on the slide. There are three objectives. First, how to, at home, use electronic approach to deal with self-management and also online resources and also digitals to put them in use in order to test. And also the online and also to get in touch in medical professionals to control our health and also during the emergency. So these are the three objectives. What is the digital health? This is what is digital health? Is use of computers, smartphone, and tablets to help us to deal with health and wellness. And I will tell you the benefit later, but unfortunately, there are people who take the advantage of this digital health to pry on your information. So if you get a resource and you know about them, you give them the PH and the social insurance number or address or date of birth or financial information. Normally, we won't ask for financial information, but if someone asks you for those information, but you don't know them, the resources, and you whether or not they're credible, I will think you have to know about this first. So digital health. So self-management is a part of the area that can help. Well, I give you three examples on the right. There are some smart watch can measure the blood oxygen. I will talk about this later, and also the heartbeat, and also many smart watch can have that kind of function in the middle. So this is the smartphone. You can download many apps to help you to keep your exercise pattern. Dr. Ling is so good that to talk about the 30-minute exercise, and there are so many examples. I will also offer you some free apps which are very helpful. I will talk about that later. And the third one is to the left. Other than app to know about those information, we can also monitor the health data, and also it is ongoing. Dr. Ling, I already talked that you can put on the patch on your. Sorry, my microphone got off. You put a patch on your arm, and you can text the blood sugar and also measure ongoing the blood pressures. And the next slide. Under those circumstances, virtual care is also to how to use the test, the monitor, and to get the figures and data so that we have a digital medical history. And the next one is virtual care. What is the difference between e-health and virtual health? Actually, virtual health is part of the e-health. It will show you in the next slide. What is virtual care? Actually, you meet the medical professional online. I'm not saying that online I can stretch out and touch you on the screen. Virtual care, there are 3 ways of helping the patient. First of all, online communication between a patient and a provider. Just like what we are doing now, we are online, we are talking about communication. This is a more simple way. In BC, we are able to implement these services. I will talk about it later. And the secondly, and also between the provider, between doctor and nurse, and all our caregivers, how to get together on the virtual care to help a patient. Like in the remote area, I would talk to the doctor in the village, and together we can help the patient in the emergency situations. This is the second example. The third example is a hybrid care. What is a hybrid care? Is a combination of in-person, person, and care visits. And some patients have these medical data provided all to the caregiver, so that together they can monitor the medical data, and they can tell that, oh, after you eat white rice, the blood sugar increase suddenly, so that you can avoid tomorrow in the future. Next slide. Under virtual care, there are some, in terms of time, there are some different ways, like the video conferencing. This is the first one. We can also by telephone. This is most popular, the primary mode of virtual care. But if you can see the patient, that would be much better. Like if someone cut the face, the wound, whether or not need to go to the emergency room, over the phone is difficult to get a full picture. But with video conferencing, it's much better. And text messaging, how to see a doctor by text messaging? Well, if I have some skin problems, whether or not I need to consult a doctor, if the patient take a video of the skin areas and show it and send it to the doctor, family doctor, with that help, the doctor doesn't have to talk to the other caregiver at the same time. It's easier to deal with it. The next slide. What are the benefits of this virtual care? That would be, first of all, save time. Well, you don't have to drive to the ER or driving to the family doctor clinics. It's taking some time. Other than saving time, under some circumstances, it's not because of the time. We need to make a decision. Like in 3 a.m., and there was some chest discomfort. This is the first time whether or not it's a heart disease, whether or not I need to go emergency, or I have a huge dinner. The digestion is not working well, so maybe I should wait until tomorrow. While if there are virtual care technology, we have this opportunity. This is available in BC. At that moment, if I want to caregiver to help me, it not only saving time, it can make a decision at that moment. And not only it will giving the information to the medical professionals, and the patient are not so nervous, and they know how to respond to the situation. And also, in under our medical system, with this e-health, that will reduce the patients go to the emergency room. Actually, most patients don't want to go to emergency department because it was a long line, 4 hours to 10 hours. So most people don't want to go there. If we have the availability of virtual care, it will be very beneficial. If the patient has some transmittable disease, by way of virtual care, that patient doesn't have to see the doctors in person to decrease the health risk. And also with this approach, people can get the medical service easily. What are the limitations of virtual care? Well, with virtual care, there are limitations. We could not do any clinical service. We could not able to check the heart, and at this, we are not able to do the full body check by virtual care, or we cannot do the ultrasound or take the blood test by virtual care. So there, we are not able to go beyond that. So under that setting, you have to go to the hospital at 3 a.m. with chest discomfort. I suspect that it is a heart disease. Even if it's inconvenient, I would still ask them to go to the hospital. We can do a diagnosis. Well, the cut on the face, you cannot treat it at home. You have to come to the hospital so we can stitch the wound. So maybe telling you to go to a clinic with a medical professional. And that's why it's very acute emergency. Under that situation, if there's a stroke, please don't use the virtual care. Dial 911 immediately to go to the emergency room. The next slide. In virtual care process, you have to get prepared. In BC, how to get this virtual care, I will talk about it. Before this virtual care communication, you have to get prepared. First of all, you have to, if you have a family doctor, you could consider with his clinic whether or not the virtual care is available. If it is available or not, what kind of virtual care, by telephone or by computer. So, and also ask under what circumstances you can use it, and also tell you what kind of device or equipment will be needed. Is a smartphone, tablet, or a computer, or what kind of software to be used. Thirdly, you need to, when the virtual care is connected, what kind of lighting and what kind of environment would be suitable. Would be told, would be advise you how to prepare that environment. And if your families also attended the virtual care, so please use headphone or you can use the speaker so that the family member and you can communicate with the doctor at the same time. Like a parent asked, told doctor, I will bring my child. And also the app that to be used, the most popular platform is Zoom, but whether or not your family doctor or other medical professional, they are using Zoom or the other platform, you have to ask first. During the virtual care, you have to, if it is the first time you use it for an emergency or the walk-in clinic, it's the first visit, you have to make your health insurance card available, and they will ask for the card number. If your family are with you, you have to tell the professional that my family is participating. And thirdly, when choose a well-lit location, and hopefully there will be a window, and you are facing the window, so it won't be you will be well lit your face and also other areas. When you communicate with the professional, stay in the center of the camera. If you bend the other side, then people could not see you. So stay in the center and also speak loudly and clearly. And also the speaker have to be turned on. Have some note paper available and pen. If you're using your smartphone, you are recording you can write down on the smartphone what the advice given to you by the medical profession. If you are your medical history, we normally ask you what kind of medicine you're taking, any allergy to medicine, and what are the symptoms. And on the first visit, we will ask all these questions. The next slide. There are four factors that you need to be performed at the emergency situation. Those are the very significant indicator. First of all, the body temperature. If you have a thermometer to the left, or you can stick onto your forehead, or there you have a very advanced device we can stick into your ear and to get or there's a camera you're facing a camera, then you can obtain the temperature. You don't have to be using a very complicated device. Or put it on your mouth or under the armpit. If you want to get this kind of device, you can go to the drugstore. The pharmacist will give you advice. The next one, first is the body temperature, and the second one is the blood pressure. So we talk about the three high. Every year you have to pay a visit to the doctor. One of it is the blood pressure. You can self-manage and have some preventive measure, like some blood pressure monitor. Like you don't have to use it only because of hypertension or diabetes. Actually, a blood pressure monitor is a very primary tool. Price between $50 to $100, you can get a very decent monitor. You go to a drugstore or pharmacy, the staff there will give you a recommendation, and you can consult your own family doctor. You can go to the presented CA hypertension CA website, and they will explain to you what kind of blood pressure monitor is regarded as the best device. They will give them a gold credit recognition or a silver recognition. Go to Hypertension Canada website. They will recommend you to a good. I recommend every family there should be a blood pressure monitor. The third indicator, the vital indicator, would be the body temperature and the blood pressure, and then it will be the heart rate. And when you go to see some traditional doctor, they will test your pulse on your wrist or your neck. If you have a smartphone with a free app which can help you to test your heart rate. Assuming is one of the example. I have no relationship at all, no conflict of interest. I don't. I don't receive any monetary benefit to me. It's a free app. You download this app. You put a finger on the screen. It will then take your heart rate. This one got 86. You can see the variation of the line on the screen, up and down. To the left, there's a watch. There are many watch can take the heart rate. That app is free. The watch is $500 to $600, even up to $1,000. It can give you your heart rate, and also that will help you. And the next one is oxygen saturation. Well, this is more important to the COVID-19, which can impact on your lung. It will cause a low oxygen saturation. To the left is available in the drugstore. You can ask the pharmacist there; they will help you out. Maybe $50 up to over $100. Something in the $70 would be very decent. To the right is also a smartphone. Well, if you are testing for the oxygen saturation, it's not good on the wrist. It should be better on the finger. The second to last slide, we have a benefit in BC to get to the Health Gateway platform. After you register there and you sign in, you can see all the medical history data, like immunizations, your lab tests, or your the visit to your doctors. In the future, you may be, I don't know when they are trying to prepare to let you know when you will be able to see some specialists or some doing some lab tests. The HealthLink BC, Barbara have already mentioned, it's not only you can get health information or some information have been translated into Chinese. You can use another app to translate those information from English into Chinese. If you phone them, you have some health issues, you can phone them and ask them. If you are not able to communicate in English, you can just say Cantonese. They will bring an interpreter, or you can say 普通话, and they will get a 普通话 interpreter to help you. The nurse will talk to you. If it is necessary, they will get a medical doctor to be consulted by a medical doctor. I'm one of those doctors working on the 811. and we can use the virtual care. People, you can call this number anytime to ask questions. Okay, I can leave the back to Barbara. Thank you, Dr. Ho. You have talked about the health gateway. I would like to introduce this. Thank you for your time, Dr. Ho. And you are now currently, Dr. Ho is in Toronto, remote, talking to us. Health gateway is available in province of BC. It is established by the BC government. During the COVID-19, many people get immunized, vaccinated. During that time, many people use the BC service card to in the smartphone and download into your smartphone. If you turn on the BC card app, there will be a item health gateway, and if you press that, you can get a wide range of information from the blood test result up to 2019 up to 2023. All the lab tests, blood tests, colon tests would be available there. You can see all those records, and you can print them out. Other than that, also the pharmacist record, what kind of medication have been prescribed and what have been, it can date back to 1995. Thirdly, immunization record. If you have your shot in the BC, blood clinics in BC, or at the pharmacy, all these would be recorded in this health gateway system. For the last 7 years, what kind of medication visit would be available, including your family doctor and specialist. And during COVID, you have take the vaccinated would also be recorded. As Dr. Ho already indicated, in the future, more and more information will be available. So I strongly recommend patient. Many patients told me that they cannot find a family doctor. All the family the medical history is not available. So with this platform, you can keep track of all your medical history. With the child or minor, a parent can sign up for them. Then there's another one. In November, BC government have released some new program to helping people with diabetes can get more tools under the BC PharmaSafe. As Dr. Ho indicated, testing and monitoring are very useful at home, especially at the early stage of diabetes. When you are taking medication, we need to have this keep track of all your blood sugar trend. So in BC now you have the subsidy, or the coverage will be extended, including more device and tool. Dr. Ling had indicated that the painless test, I think this is the latest device. You just put it in your arm, and you can put it on your arm for 14 days. And now at the very beginning, there's only one brand. There's another brand is also included in the coverage. This is not the latest model. These tools would help people with diabetes with all this testing. You don't have to poke your finger every day. It's very painful. It can last 14 days, so you can keep track your blood sugar ongoing. So you can go to the website of pharmasafe.com. Oh, good. We bring back Dr. Ling and Dr. Chang. Thank you, the two of you, to stay behind. There are some people have already put in some questions. Some of them are really meaningful for some questions to be answered now. I ask those questions now. Well, also, there are many other questions in the Q&A box. And if we are not able to finish them, we will leave it back to the follow-up workshop. The first question, Dr. Ling, the lung function, back function, would that affect the heart condition? I have to talk about the close relationship between lung and heart. If the lung is not working well, depending on what disease, if the oxygen is not enough carrying to the heart, some of the lung disease will cause the damage to the heart conditions. Sleep apneas or the right atrium would be affected too. So they are closely related. So if they have this condition, they should consult the doctor. Yes, they are closely linked. So there must be follow-up to see how progress. Dr. Ling, the other question is for you too. From time to time, I have some chest discomfort, and in order to relieve, I have to take deep breath. Would that mean that the coronary artery is a clog? Well, it depends. It may be or maybe not. The best way is to go to the doctor to go through the EGM and also do some stress testing, and also sometimes do you use the colored ultrasound test. If this friend have there's a high risk for heart condition like the free highs, I advise them to go to see the doctor. Well, it would be great if it's nothing to worry about, but go there and prevent in advance. Dr. Cheng, this friend asked, what does it mean by sinus with the first degree AV block? So the heart rate is normal, but they are told that they were first degree AV block. It's a normal result. If the sinus rhythm is an AV block, I've told show you the diagram. The sinus node to the U.S. Canada boundary. If the conduction is slowed down, so it will be slowed down. But most of the times, it is related to age and also your medication. It's not a serious factor. So if you can't remember anything, because it's the first degree, it's not only the second and the third degree it may cause more concern. Dr. Chen, the heart rate rhythm about 50 or up around 50. Is it a stroke factor? The normal heart rate is 60 to 100. During sleep, it will slow down. It's normal. It's okay. Even it get to as low as 40, 50, it won't have impact on the heart. While unless when it is a 50, that cause you a lot of discomfort. While you're exercising, if you want to increase your heart rate, it's supposed to be go to 90, but it cannot reach 90. Like you're driving, you push the gas, it won't go up, unable to go uphill, then it should be a concern. So depending on the condition, if it is 50 when you are static, that is not a concern. I have met some patients, they have a lot of exercise and active, so their heart rate is only 40 something. What about my heart rate up to 86 to 90? Well, that's on the other side of the spectrum. If it is higher, normal people, the heart rate will go up inheritedly. Well, my heart rate is 80 to 90, even though when I was sitting, it's not a disease. If you have no medical condition below 100, it's not a problem. Like what Barbara you said, if you are exercising, if you say that I have to be 90 no matter what condition, when I was sleeping, when I was sitting, well, that would be a problem. Well, the electric current is not appropriately conducting to give the heart the appropriate stimulate. I know most circumstances below 100 or below 90 is not a concern. Dr. Ling, the back pain, would it have any relationship with the heart? There are many factors for back pain. With the back, you have a muscle and the bone. Most of the time, it's structural issues. But this question is a very good question. Sometimes the coronary heart disease, one of the symptoms is the back discomfort. The artery, no, if it is swollen, then there will be pain, back pain. If the acute pain causing sweating, you have to go to the emergency room because of the main artery maybe have been damaged. So if you are not sure, you have to go to see a doctor. Thank you. Another friend, also AV block. Would it be reversed? Would it be back to the normal? And also long haul flight, would it be a concern? I will let Dr. Chen answer this. If your AV block is inherited, or is it aging, then it won't return back to the normal. Your car is used, it is used. But if it is medication called this, so you have to determine whether or not you are the first or second. Some senior they have dementia, they are taking medication, it may have impact. So you have to balance out whether or not it's causing some AV block, but with some AV block, there's no symptom. You may be taking the chance. But most people, if it is on first degree AV block with no symptom, so it's only the EMT, it won't be a concern for health. You don't have to be over concerned. Some the patient, my heart beat is very irregular, sometimes fast, sometimes slow. Under what circumstances is a concern to go to see a doctor or to take some tests? two questions to answer. If this is irregular compared to the normal condition, well, I feel it is so slow. It will suddenly drop. If you can describe so radically, of course, you need to go to monitor and to take a test. Or on the other hand, it's going so fast, it's rushing up to 130 or 140 without any reason. Well, if this is not something that is normal, then you have to go to see the doctor and you have to ask the doctor to see, to go through the regular tests. It's not so time consuming to take those tests. While under extreme cases, if the patient are fainting, if the electric current is so the patient is collapsed and then came back and become like it is normal. Just like when you turn off the light and in the evening and then turn it on, then if it happens like this, it is a concern. So whether or not this is a electric currents turned on and off without any reason, so you have to go to the doctor or to the hospital. Thank you. This patient has a pacemaker. Is it true that he have to change every 5 years? Is this process safe? If it is going to be replaced every 5 years, there's almost a must for you to have a pacemaker like an iPhone, and you have to turn it on all the time. If you turn on 24 hours around the day, then you have to replace it every 5 years. Secondly, or it's an old model. So the pacemaker battery won't last too long. Replacing the battery is a minor process. You don't have to deal with the why. Just put in a new battery with a small hole. But it is necessary. This is the last resort. It is for you to protect. It won't go down to 50. If you have AV block, heart block, if you don't have the pacemaker, your heart rate will go down to 0. So you need it. You have to replace it. With the latest technology, replacing the battery is nothing. It's very simple. So if it's 50% of the cardiovascular artery is blocked, was it necessary to go through the surgery? You should answer it, Dr. Chen. 70%. We will have to answer if it is 70%. If it is only 50%, you know, the Western medicine, there's a cost for any procedures. There's a good complication of 1 in 500 chance of complication for this process. Most doctors will tell you that it won't worth it unless you have 70% risk, and with symptoms, then you have to weigh the pro and con. 50% we will go with the medication. Oh, Dr. Ling, sleep apnea has anything to do with the heart disease? Sleep apnea is during the sleep, the oxygen supply is not sufficient. The airway of your respiratory system, because of the fact it was blocked by the airway during the sleep, and some people were not breathing normally and snoring loudly. the body react like this. We try to breathe hardly, so the blood pressure will go up. Normal people, the blood pressure will go down. But people with sleep apnea, they would still have high blood pressure because they try very hard to breathe more in order to get more oxygen. What is the impact on the heart is high blood pressure and stroke, better chance of stroke. Without proper treatment on the vein in the blood in the lung will go up, the pressure. So sleep apnea is not only dealing with sleep. You have to address it. So it have to see what kind of specialist. The first, you have to find out whether there is or not. It's not. There's a procedure that you can monitor it at home to see whether or not the oxygen level goes so low, then the airway have been blocked or not flowing smoothly. When it is confirmed, the doctor will to get a machine to put it on. If it is a fat people, reducing the weight is body weight is a good way, and high blood pressure patients, you have to address it too. Sleep apnea, people with apnea, as indicated by Dr. Chen, it will also affect the heart rhythm. While you are not relaxing during sleep, the blood rhythm would be more probable. The next question that they have put on stent 8 years ago. It seemed working well. Why have to take the aspirin long term? Well, the stent could only for the short term. It will clog again. So people, doctor recommend aspirin or some blood thinner medication. Why aspirin is still prescribed much later? Since the person have already been some coronary disease, the aspirin is protecting your blood vessel to long term. Not only the section of the blood vessel where the stent was inserted, because that person have already been required to put on stent. It's trying to using the aspirin to keep the blood vessels unclogged. So aspirin has nothing to do with the stent. The situation of the patient require to taking aspirin to mitigate the risk. So it is a lifelong medication. So it's for protection. So to keep the blood flowing fully and smoothly.
Okay, we have a attendee here who was about it's like a lotus root. Is there any remedy for this problem? Dr. Chen, your turn. About Dr. Ling, you're putting me on the spot. Okay. Let me answer this first. Now, usually, if there are areas where the blood vessel is narrow, where some parts are too wide, it depends on whether it's hereditary or not. But because actually, the risks are high. In other words, the coronary artery disease the risk is already there. So it's not just as simple as having a surgery. So because there's also the high blood pressure, high cholesterol, and diabetes. So we want to stop the blood vessel from narrowing, and if you keep drinking or smoking, so there may be more narrowing for that. So, Dr. Chan, do you want to add some more? Yes, I have something a little bit to add. You're talking about lotus root. This is the only time that I've heard an analogy like that. Ataxia is different. Ataxia is hereditary, meaning this the shape of your artery is a little weird. Some spots are narrow, some spots are wider. So it's not the same thing. Usually, when do you do it? When you do a CT. So by chance you may find it up, but rarely it's not like ataxia where it's like a lotus root and you can treat it. As far as I know, the tear of the artery, this is not directly connected unless the wider part is very, very part of more than 45 millimeters. So you're absolutely right. The 3 highs, you have to control them. Your blood pressure cannot be too high, otherwise it will expand further. Other issues you have to consider, for example, diabetes and high blood pressure. Ataxia itself, do you need a stent? No, actually, you don't need to do anything, but you have to manage the risk. So as long as you don't let the narrow part blocked up or the wider part getting too wide, that should be okay. Okay, this is a long question. To lower cholesterol, although medications will help maintain heart health to prevent stroke, heart disease, and usually if the artery is clogged, so to which extent would you need an angioplasty? Who should answer? Oh, other than medications, are there other natural ways to lower LDL? Okay, Dr. Ling, fine. Now, if you already have blood vessel problems, medications do not help entirely. It only helps to lower blood pressure, especially bad cholesterol, LDL. This is one of the reasons that the blood vessel is clogged. But usually there's a statin, which is a type of medication that will lower your risk of your blood vessel being clogged, and for those who have coronary artery disease, this would be good for them, or if those who have heart disease, it is good for them as well. So actually, overall, this is good for the heart, and these medications, statin, not only lower your cholesterol, there's a protective mechanism because it, for example, the sclerosis will stop them from deteriorating, and so if you don't take those medications, the chances of being blocked are higher. So the coagulants that are built up in your blood vessels won't be too bad all of a sudden. So if you have medications, you should take those medications. Medications control your LDL. Other than medications, what else can help? So we have talked about diet. You have to watch out for your diet, especially not eat too much foods that too many foods that have trans fats, like deep fried foods, because deep fried foods make your bad cholesterol go up, and also saturated fats. You should eat more. Or eat some, but not all. For example, not so much red meats. Preferably, you should eat more saturated fats, non-saturated fats, where like olive oil, or do exercises like Dr. Chen said. So doing exercises help to control your cholesterol, to have control of 3 highs, and help your heart. Thank you. The last question, Dr. Chen. This attendee has already got atrial fibrillation since 2001 and is he has not seen a specialist ever. So he's only gone for updates regularly. But he's on medications as Exalotol, and another I don't think is spelled right. But anyway, does he have to follow up on it? If you're already taking blood thinner, and the doctor may have given some thought about that to give you the appropriate treatment. For example, blood thinner, the major objective is to lower the risk of having stroke, but most patients don't really have to see a specialist, but probably they should regularly check their medications. For example, if you are taking blood thinners, are there any complications? Are the heartbeats irregular? Are they too fast? Are there other symptoms? Also, regular check of your kidney functions. Because the dosage depends on your kidney functions. And over so many years, have you done the colorful sonic ultrasound? And because if you don't check your heart functions, you don't know how your function level is. Maybe you have already got failure, so you don't feel it. Well, at least there is the basic ultrasound, and if the family doctor has given it some thought, then you should also see a specialist. But yeah, someone has to follow up on it, right? Correct? Every 6 months to a year, so you have to at least go and check the status of your condition. There should be a specialist who is dedicated to this. So it's a chronic disease, so you have to sit down with a specialist for 10 to 15 minutes to talk about this. So because of time constraints today, that's all the answers that's all the questions that we can answer. Those we have not answered, well, hopefully in the near future we will have another webinar to answer those questions. Now I thank Dr. Ling and Dr. Chen, especially Dr. Chen, who is in Hong Kong to do this talk, their presentations with us today, and provided share with us so much information as well as community resources. So I hope that everybody will fill out the survey questionnaire, complete it, and if you have not, you're not on the mailing list on the email list, well, you can scan me, look at the QR code, and then become a part of our mailing list, and we will tell you what our next activities are. So we thank our partner Patients as Partners initiative, and we also thank our partners in the community, so many of them, and to support us, to help us. And we also appreciate our media partners' help to help us promote this event, and also publicize this event. We also thank the viewing hubs, those organizations that organize viewing hubs. There are 4 of them: CRC Health Center, South Vancouver Neighborhood House Success, and Villa Cathay Care Home. I thank you all, and thank those attendees who are here in live, and especially the 3 speakers, Dr. Ling, Dr. Ho, and Dr. Chan. Thank you very much for taking your time and share such valuable information with us. We also thank our interpreters, Shiny, Wenhui, and Cliff, and Refek. You're welcome. And tomorrow we have more presentations. But for today, this is the end of our presentations. After all, prevention is better than treatment. So maintain good health while you're still young. So even if you can treat it, it doesn't mean that it's better than prevention. So while you're young, I still have a chance to learn more about chronic diseases